I take great pleasure welcoming you all for today's CME. Today we have four eminent speakers who are going to talk on oncology, surgical oncology, cardiology and CTVS perspective. Next slide please. Max Healthcare is the second largest hospital group in India. We have 16 hospitals, all are NABH accredited, ISO accredited. Some of our hospitals are Joint Commission International accredited. In fact, we are getting patients from 135 countries across the globe. We do get a lot of Nigerian patients too. Our capacity, we have 3,400 bed capacity, 4,800 doctors, 15,000 supportive staffs. All our premises are NABH accredited. 3 of our premises are Joint Commission International accredited. That is the reason we are getting a lot of international patients, and we would have treated close to 3.5 million international patients. And Max Healthcare, in the year 2020, we could do the gross revenue of 600 million USD. And Max Healthcare is listed in stock exchange, and our market capitalization is 3.5 billion USD. Next slide, please. And Max Healthcare, we are leaders in many specialty and super specialty. In fact, we are leaders in, currently we are talking two different topics on oncology and cardiology. Even we are leaders in oncology and cardiology too. We have got a Max list of oncology, wherein we do all the oncology work. Either it is neoadjuvant chemotherapy or chemotherapy, palliative therapy, immunotherapy or bone marrow transplant. And we have close to 100 plus oncologists in Max group of hospitals. Medical, radiation and surgical oncologists, and they all are working together to alleviate the so-called pain of the patients, cancer patients. And Max Healthcare, we are leaders in even this cardiology too. We have got a Max list of cardiology, wherein we do all the heart related work like angiography, angioplasty, ECMO, LVAD, cardio. Max Healthcare, we are doing Asia's largest bone marrow transplant program, and we are doing North India's largest oncology program. Next slide please. We do a lot of complex surgeries. I just want to highlight some census or statistics what we could do in the year of 2020. We performed close to 800 plus transplant. Max as a group inclusive of Max Healthcare, BLK Max and Nanavati Max. And we did 600 plus robotic surgeries, 31,000 cardiac surgeries, 8,500 neurosurgeries, and 21,000 orthopedic surgeries, and 7,500 oncology surgeries. And probably in this slide you can also see the recent medical accomplishment, Max Healthcare as a group, what we could do. Next slide please. Care is due to state-of-the-art infrastructure. We have robotics, TrueBeam STX Linux system, cath lab anti-ZPU, and S8 navigation with OM, RadExact tomotherapy system, intra-OP portable CT. We have all advanced equipments with Max group of hospitals. Next slide please. Next slide please. Max Healthcare as a group, we have received a lot of awards and recognitions, either in clinical safety or operational excellence or service quality, and we have received a lot of awards. And recently we got Patient Safety Award by FICCI, and Best Use of Six Sigma in Healthcare, and Best Customer Service in Healthcare, Best Healthcare Brand, and so on. Next slide. Yeah. The success of the Max Healthcare is our senior clinicians. Max as a group, we have got a lot of senior clinicians. We have close to 4,800 doctors with us. And any specialty, we have top-notch doctors with us. For instance, if you take liver transplant, we have Professor Subhash Gupta, who is one of the leading liver transplant surgeon in the globe. And for kidney transplant, we have Professor Anant Kumar. He is one of the finest renal transplant surgeon in the globe. And oncology, it's headed by Dr. Hari Chaturvedi. Dr. Hari Chaturvedi is having 25 plus years of experience in the field of surgical oncology. He was a past president in Indian Society of Oncology too. And similarly, minimal access and laparoscopic surgery, we have Dr. Pradeep Kumar Chaubey, and he has done so many thousands of surgeries. Next slide, please. Here, we also focus in research as well as academics. As far as research and plus journals publication in last 5 years, and we have 80 plus ongoing clinical projects. And as far as academics, we have 430 plus postgraduates enrolled in 30 plus specialities. Next slide, please. In international patients in India, we have Commonwealth, independent states here and everywhere. And MAX especially kidney transplant, liver transplant, bone marrow transplant, all cardiac procedures, minimal access surgery, bariatric surgery, and so on. And many patients, they prefer MAX group because JC accreditation and no waiting time, affordable cost, and global connectivity. And we have all senior talents with us. Next slide, please. In international patient service, we do pre-admission service, post-admission service, and post-discharge service. The moment we receive the query, we issue the treatment plan, we assist for the medical visa and attendant visa, we do the pre-boarding formalities, on arrival formalities will be taken care by our team in India. In general, we provide the comprehensive treatment solution to all our patients. Next slide, please. MAX, we have operations in many parts of the globe. Even we have offices in so many parts of the globe. In Nigeria also, we have registered office called MHC Global Healthcare Nigeria Limited in Lagos. Next slide, please. MAX as a group, we do a lot of engagement activities for Nigerian doctors as well as patients. Especially this program, we call it as CME. We do the webinars also, and we do health talk, and we are also doing OPD. Doctors from India, periodically they come down Nigeria and they do the OPD, free OPDs, and we do virtual OPDs and teleradiologies. We have partnership with hospitals in Nigeria. We do the surgeries and operations and management. And we also train Nigerian doctors by means of observership and fellowship free of cost. And we also promote medical travel to MAX India for advanced care. Next slide. 16 hospital under MAX. One of our hospitals is Nanavati MAX Super Speciality Hospital. It is a very old hospital which is having almost 65 years and old. The hospital is having 350 bed capacity, and we are doing 55 plus speciality in Nanavati MAX Super Speciality Hospital, which is located heart of the India, Mumbai. Next slide, please. And Nanavati MAX, we do all procedures. It's a tertiary care setup, and we have well-equipped operation theatre 10 plus, and we have ICCU, MICU, SICU, NICU, PICU, adequate numbers, and we have cath lab, and we have full-fledged oncology setup, and both medical, surgical, radiation, all oncologists are working together. It's like organ-specific approach, and we do have the tumor board, and we treat all oncology patients. And similarly, we do a lot of cardiology work. Today, our cardiology doctor has joined, CTVS doctor has joined. We do LVAD and all advanced procedures. Next slide, please. I take great pleasure of welcoming you all for today's CME. I'm very happy to welcome Chief Dr. Bello Abubakar. Dr. Bello Abubakar is ordinand, and Dr. Bello Abubakar is attached with the National Hospital Abuja. And Dr. Bello Abubakar has travelled different part of the globe, and he has attended a lot of national, international conferences. He has presented a lot of papers. He does a lot of clinical work, and he is very much interested in academics too. I take great pleasure of welcoming Dr. Bello Abubakar. Welcome you, sir. I am very honored cardiologist. He is a consultant cardiologist. He is from Abuja, Nigeria. Dr. Henry Oshaju has travelled different part of Nigeria as well as abroad, and he has presented a lot of papers, and he is very good in clinical work as well as academics. I take great pleasure of welcoming Dr. Henry Oshaju.
Thank you.
I am very happy to welcome Dr. Vishal Khullar. Dr. Vishal Khullar and has very good experience in many parts of the globe, and he is the one who does a lot of LVAD related work, and he has got great knowledge in the field of CTVS, and he has got a lot of clinical. Chitkara. Dr. Garvit is one of the leading senior oncologists. He is a surgical oncologist. He is from Nanavati Max Group of Hospital, Mumbai. And Dr. Garvit Chitkara has traveled different part of the globe, and he has presented a lot of papers, and he has got a lot of prestigious awards in the field of surgical oncology. And Dr. Garvit Chitkara, he believes in organ-specific approach, and Dr. Garvit Chitkara is focusing on breast oncology. I take this as an opportunity to welcome Dr. Garvit Chitkara from Nanavati Max Group of Hospital. Welcome, you, sir.
Thank you.